Hello everyone, my name is Jose Lorenzo. Exercise chapters 24 to 34. 24. Match the two parts of the sentence. Number 1. Say the UK launch of live Ethernet. J. 2. Chicken and pox is a common infections effectors. A. Pre-rabies as an incubation A. For the patient remain febrile age 5. He was admitted with a 4-day history of influenza-type symptoms of fever with B. 6. Kid a proportion of patients who recover from hepatitis B, C. 7. The central part of Africa is in the midst of an epidemic. F. A. Measles is most D. 9. Lyme disease is caused by transmission. G. And 10 stands for E. Complete the case reports of the patient in A opposite. On examination, he looked unwell. His pulse rate was minute. He had a palpable spleen. The combination of fever, rigors in a patient who has recent returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 and 14 days. 14 days. In this case, the patient admitted he had not been taking prophylaxis irregularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentence. Number 1, an infection which can be treated successfully with antibiotic is curable. 2. Another word for an epidemic is an outbreak. Free bacteria and viruses are examples of microorganisms. For someone whose temperature is normal, is a febrile and aberrational. 5. The common infection with Epstein-Barr virus is known as glandular fever. 25. Complete the table. Affective anxiety, anxious behavioral dementia, dement disturbance, disturbed suicidal. Make word combinations using a word from each box. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, and substance abuse. Complete the sentence. The way a person behave is or her behavior. A person's emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with IM is called senile dementia, a disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary action is compulsion. Which symptoms of depression was his patient suffering from? She was suffering from fatigue, tiredness, loss of interest, and sleeping poorly, insomnia. 26. Complete the table. Blindness, consciousness, deafness, dizziness, numbness, lightheadedness, and unsteadiness. Make word combinations using a word from each box. dull vision, epileptic fit, prodromal symptoms, syncopial attack, urinary incontinence, and visual acuity. A doctor is trying to determine the cause of loss of consciousness. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worrying or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were in consonance? 27. Complete the table with words from A and B opposite. Absence, absent, diminution, diminished, placid, spastic, spastic, wasting, wasted. A doctor is giving instruction to a patient. Number one is like you to relax. I just going to move your arm up and down, muscle down. Can I see your hands, involuntary movements? No, I going to straighten your arm out. Try to stop me. Muscle power. And four, can you touch my finger with your and then touch your nose? Coordination. Complete the sentence. A flaccid hand drops line light for a right angle with the wrist. Wrist reflex that are stronger than normal. Free muscle wasting means the muscle is reduced in bulk. A tick is a form of voluntary movement. A cave is often used to test the Babinski response. His coordination was poor. He could not perform rapid alternative movements. A reflex hammer is used to test reflex. When something is diminished, it is less than normal. A patient is brought to a NC, GCS, a opening, pray, verbal response 1, motor response 1, GCS score 5. 28. Complete the table with words from A, B, and C opposite and relate forms. Verb, nouns, and adjective. Curative, excisions, growing, invasion, invasive, obstructive, palliative, palpation, palpable, spreading, swelling. The notes below are about the patients. 6, 3, 7, 2, 8, 4, 5, and 1. Complete the sentence. Distant spread or tumor cells is known as metastasis. Many symptoms of cancer, such as difficult swelling, are due to obstruction. The opposite of painful is painless. Malignant neoplastic colon cancer, tumors which do not invade of metastasize are benign. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. A pulpal liver suggests metastasis. 29. Complete the sentence. Number 1. A baby dying is born a week before the ADD is premature. A termination of pregnancy may be necessary for medical seasons. For the first 3 months of pregnancy are known as the first trimester. For fetal distress is the first stage of labor is in indication for cesarean sections. 5 is was breech presentation or delivery was for forceps. Miraculous is another term for spontaneous abortion. And 7, the umbilical cord was one twilight around the baby's neck, and it was unfortunate stillborn. Complete the table with words from A opposite. Birth and no. Abortion, delivery, and thus induction, miscarriage, present presentation, termination. Dr. Bennett is presenting a patient at a weekend meeting in the obstetric unit of a hospital. This is Clara Davis. She come to the antenatal clinic at 9 weeks. In her past obstetric story, he had a pregnancy when she was 18, which was terminated, and another one a year later which spontaneous abort since then she was had 3 pregnancies. In the first the baby was delivered normally at 4 weeks. In the second she had an induction of labor at 3 9 weeks because of fetal distress. The third baby present as a branch and was delivered by cesarean section. Theory: make words combinations using a word from each box. Blood state, breath sounds, pleural rub, productive code, vocal resonance. Rewrite the questions. Number 1, if is your code productive? Do you code of any phone? 2, what color is the sputum? The color is the wallet. 3, it is ever Portland. It is ever yellow. Have you ever had the autopsies? Have you noticed any blood in it? Do you suffer from dyspnea? Any problems with your reading? Are the following sentiments true or false? Number 1, a patient who has a lost cone produce water. True. Crackles are heard when the airways are narrower. False. A patient who has a non-productive cone produce sputum. False. Wheezes are typical of pleuritis. False. A pleural rub is a sign of asthma. False. 31. Complete the description. 1. Shingles episodes usually starts with pain and soreness, then red spots appear that develop into groups of small blisters over a particular area on one side of the body. In most patients, new spots continue to appear for 3 to 5 days. The small blister become filled with pus and then form scabs. In several cases, there may be scars afterwards. Read the description of the rows of rubella and complete the notes. The spots are scarlet pink muscle which appear first behind the ears and on the forehead. Location and distribution: we spread grouping scarlet type of lesion muscles, color pink. Complete the notes for the rash in the photograph and so a diagnosis. Location and distribution: we spread on the chest and abdomen, grouping scarlet type of lesions, muscles and pupils, color pink. Complete the notes for the lesion in the photograph, location and distribution below lateral end of the left eye, grouping single lesion, type of lesion, nodule, color white or pink, basal cell carcinoma, BCC. 3.2. Write the corresponding medical terms for the ordinary English words. Common word, medical term, and type of force. Bruise, contusion, blunt. Cut, inside wound, sharp. Gross, abrasion, blunt. Scratch, abrasion, blunt. Stab wound, penetration, sharp. Tear, laceration, blunt. Choose the correct words to complete the description of the injuries shown in the illustration. There are growths above the left eyebrow and on the left side of the neck, a contusion to the left side of the lower eye, and tears to the left cheek. Write a description of the injuries shown in the illustration. There are multiple growths on the face and upper chest. There is a contusion on the cheek and several cuts on the torso. The injuries appear to be caused by both blunt and sharp forces. Complete the sentence. 1. Frequent changes of position are necessary in the immobile patient to prevent to develop of a pressure sore. He had a several step once in the abdomen from the neck. He was knocked unconscious by a heavy blow to the head. The wounds were only superficial and required no treatment. Frequent log a conversation in a opposite and complete the notes. Frequency nocturia for 1 year. Dysuria or hesitance, showing a little weaker. Incontinence apart from occasional dribbling. Match the patient descriptions of their symptoms. I had to pee every half sore or so be. I get a standing pain when I pass water. A. I have to get up several times to pass water at night. A. I have to rush to go to the toilet. F. I have trouble getting started. D. I can't hold my water. G. I pass on blood in my urine. C. Write the doctor's questions for each of the symptoms. There was blood plus and protein plus in the urine with no cast. Describe the finding of the laboratory. 1. Frequency. How often do you pass water? Dysuria, do you get any warnings of pain when you pass water? Nocturia, do you have to get up at night to pass water? Or Hansen, do you have to rush off the toilet? Hesitance, do you have any trouble getting started? Incontinence, do you ever lose control of your bladder? Hematuria, have you ever passed blood in your urine? Before a doctor is talking to a patient during an ophthalmoscopy, right, Mr. Gold, because you been having these issues, I going to have a look at your age, etc. A. The examination is done with diamond lines. B. Tropical Mydriatic Solutions. 3. To a dilatation 1. Fits out of target 4. Complete the instruction. Wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Pre-close the valve of the pump. 4 pound of the pressure. Open the valve a little and slowly deflate the cuff while listening and washing the pressure gauge. The first sound you hear is the flood. The value of the gauge at point in the systolic blood pressure. Continue listening while you slowly deflate the cuff. And 7. The diastolic blood pressure is measured when the sound complete disappears. Complete the text. One phlebotomist especially trained in taking blood. They are skilled at venipuncture, the vein to take a blood sample. The wrist, hand, and foot can be used but more often a vein in the inner part of the elbow is used. It is difficult to locate a sweet spot vein in the patient may be asked to make a fist or a tourniquet may be applied or the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tops are labeled correctly before they are sent to hematology laboratory where a full blood count or other investigation will be carried out.